A growing number of countries have said that they'll start imposing restrictions on travellers from China. Now, they're pointing to the surge in infections there after the government abandoned its zero COVID policy. Beijing has reacted angrily and, in its first retaliation, today suspended short-term visas for visitors from Japan and South Korea. Seoul says its decision is based on science. But how effective are checking test results at borders and other similar measures? We'll have more on that with an epidemiologist in a moment. But first, this report from South Korea.
Seoul's Myeongdong district once bustled with Chinese tourists, an important source of income for many traders. During the pandemic, that business completely dried up, but they hope it will soon pick up after China abandoned its zero-COVID policy.
It's nice to see the area bustling with more people again. There are more Chinese tourists ahead of the Chinese New Year holidays. But I'm a bit worried we could end up with a new COVID-19 outbreak.
I'm not afraid of getting COVID. We had such a hard time financially, and I would prefer more Chinese people to come so I can do business rather than the government restricting their arrivals.
For over a week, South Korea has required arrivals from China to undergo mandatory testing for the coronavirus. It says the measures needed to protect public health as cases of COVID-19 soar in China.
Our government's enhanced quarantine measures on travelers from China are based on scientific and objective evidence.
South Korea is one of several countries worldwide which have imposed new restrictions on travellers from China. Beijing says those border controls are discriminatory. And it's now delivering on its threat to retaliate by halting short-term visas for visitors from South Korea.
Regrettably, a handful of countries, in disregard of the science and facts, have insisted on taking discriminatory entry restriction measures targeting China. China firmly rejects this and has taken reciprocal measures.
Despite the end of its zero-COVID strategy, China has not yet completely opened up. Its borders remain largely closed to foreigners, apart from business or family visits. And it requires all arrivals to show a negative COVID-19 test. But as its handling of the coronavirus gradually comes into sync with other parts of the world, the dispute with South Korea shows that disagreements around national policies still persist.
Dr. Deepti Gudasani is an epidemiologist and expert on global health, joining us today from Perth, Australia. Welcome to DW News Asia. I'd like to start by taking a look at what a growing number of countries are doing, asking travellers from China for a negative test or screening them pre-departure. South Korea, for one, says that this is based on science. Do you think these requirements make sense from a public health perspective?
I think generally surveilling travellers makes sense if it's a sort of comprehensive surveillance from all regions to keep an eye on what variants are coming in and to reduce the number of cases of infection coming in. But it only makes sense if it's done comprehensively across the world, because we know, for example, there are really concerning variants that are growing, for example, in the US, Canada, and across Europe. And, there are no sort of pre-departure testing policies from there. And it also makes sense only if there are domestic measures that also reduce the rate of spread, because we know that no border measure is perfect. So cases will enter, even if it's the cases of a new variant. And once they enter, what happens then? If there are no domestic policies to reduce spread, things like, air cleaning, ventilation, masking, and testing with isolation, then those cases will spread domestically no matter what you do. So border policies are most effective when they are comprehensively put in place across all regions, because let's face it, variants can come from anywhere, and in tandem with domestic policies, so that if variant import is slowed down, so is spread within the community, within the country.
China, of course, is saying, just picking up on what you're saying, China is sort of saying that countries are singling it out rather than applying these measures across the board. Countries, though, and the WHO are arguing that China isn't being transparent enough. What information is required from China, and how serious is the need for reliable data from Beijing here?
So the lack of transparency is really concerning. When you look at the number of cases that we're being told about, so we were told, for example, that over 90% of the third most populated province of China, Henan, had been infected. So that's about 88 million people. When you look at that and you look at the number of deaths being reported, there's a huge discrepancy. It's not really believable. So we need transparency about what's happening within China in terms of number of cases, in terms of number of people with severe disease. We also need transparency in terms of variant surveillance. So very few sequences are being submitted from China every day, which makes it very difficult to surveil if there are new variants that may arise over time. So we need complete transparency because this is a global pandemic, which doesn't appear to be happening currently, at least.
Given what you've just said, what do we know exactly about the state of infections in China and the situation in hospitals, for example?
I think we know very little. I mean, there are, of course, the leaks on social media, and, it's hard to verify them. But, for example, if officials are saying that, more than 90 million people or 88 million people in a single province has been infected, it's impossible to think that there isn't pressure being felt on healthcare and there aren't huge numbers of deaths happening, also given the vaccination rates, particularly the elderly, where uptake has not been that high. So it's hard to imagine that the healthcare system isn't struggling, and it's hard to imagine that people aren't dying from illness, but we aren't really being told about this. Compared with what we are being told about cases, the number of deaths are extremely low. Only about more than 5,000 deaths have been reported, which even in the highest vaccinated country with millions of cases seems really, really low by comparison.
We've got about a minute left. I just want to lastly ask you about something you tweeted last week. You wrote, "I find the hypocrisy of countries criticising China for not having deployed mRNA vaccines while at the same time having opposed patent waivers quite astounding." With the time we've got left, could you just talk about what about this that so frustrates you?
I mean, we hear a lot of sort of criticism of China for not vaccinating adequately the elderly, particularly with highly effective mRNA vaccinations. The truth is that mRNA vaccines have not been widely accessible or available to many lower middle income countries. And it's not just mRNA vaccines, also drugs like Paxlovid, which are quite expensive. And these could have been made much, much cheaper had patent waivers been put in place, technology transfer agreements been put in place so that these could be domestically manufactured. Supply could be much, much higher and also manufactured at much, much lower cost and provided widely in lower middle income countries, which have largely deployed either their own homegrown vaccines or vaccines like AstraZeneca that we know are less effective. So I think there is a huge responsibility that lies with the countries that have opposed patent waivers in the middle of a pandemic, which has no doubt led to people dying and will continue to lead to people dying. Similarly with antiviral drugs, we really need to move in the direction of making these drugs accessible for all, not just the richest countries in the world.
That was epidemiologist Dr. Deepti Gosani. Thank you so much for your time today and your insights.
Thank you.